In this video, we provide more information about the Stop Unhealthy Alcohol Use Now initiative's approach to screening and intervention in primary care, with a focus on screening, brief motivational interviewing, referral to treatment, and resources for people with an alcohol use disorder. Unhealthy alcohol use refers to a range of use that includes both risky drinking and alcohol use disorder, or AUD, which is a pattern of drinking that meets some or all of these criteria: difficulty controlling one's drinking, preoccupation with alcohol, continued use despite adverse consequences, drinking more to get the same effect, and withdrawal upon suddenly cutting back or stopping alcohol use. As described in our previous video focused on people who don't have an AUD but engage in risky drinking, screening begins when a patient completes one of the brief instruments to identify unhealthy alcohol use. When this initial screening result is positive, the patient is asked to complete the 10-question Alcohol Use Disorders Identification Test, or audit. Screening-related assessment based on the audit score helps distinguish between patients with alcohol use disorder and those with risky drinking but without AUD, and then guides the clinical approach. Scoring information can be found on the back of the paper audit. An audit total score of 15 or more for men and 13 or more for women indicates that an AUD is very likely. A lower score may still indicate an AUD if questions 4 to 6 contribute at least 2 points to the total audit score. These questions concern not being able to stop drinking after starting, failing to meet normal expectations because of drinking, and needing a drink in the morning after a heavy drinking session the night before. If the provider identifies an AUD, they should conduct brief counseling to determine whether the patient is willing to set a goal of abstinence or not, and then engage in shared decision-making regarding options for more intensive treatment. Brief counseling can be guided by the 5 A's: assess current drinking behaviors, advise on alcohol use, assist in exploring reasons for change, agree on options for risk reduction and/or treatment, and arrange follow-up. This approach is based on motivational interviewing, or MI, a patient-centered guiding style that helps the patient explore and resolve ambivalence and identify their own motivations for change. Here we outline the basic skills of MI. The clinician asks permission before starting a conversation or sharing information, asks open-ended questions, makes affirmations to build rapport and offer support, uses reflections to encourage exploration and understanding, and uses summarizing to check in with the patient about the conversation and their goals. You'll see examples of some of these MI techniques in the following demonstration, which shows how a provider might respond in a telehealth encounter with a patient who, after a positive result on the initial screen, had a score of 26 on the audit.
Well, thanks, Dave. I'm glad we got to talk about your high blood pressure and about your insomnia. And I was wondering if we might also be able to talk about your alcohol use in the questionnaire that you had just filled out.
Sure, that's okay.
Okay, wonderful. Thanks. Well, I got some information from the questionnaire, but I was wondering if you could tell me a little bit more about your drinking, about how often you tend to drink and when you tend to drink.
Really, as soon as I get home from work, need to have my first beer, and we'll have several beers while I'm preparing dinner. After dinner, like to settle down and watch movies and have several bourbons. And that's pretty much a daily routine for me.
And so it's pretty much every single day that you have something to drink. And from what you're describing and what you filled out on the questionnaire, it's probably maybe 6 drinks per night. Does that sound about right for you?
Yeah, I'd say at least. If there's a family event, definitely have more.
Even more than that, 6. Well, tell me, I was curious what your thoughts are and what your concerns are right now about the alcohol use and how it's affecting you.
I'd say up until recently, I didn't really have any kind of concerns around it. It's just a part of my life. But over the past few weeks, it's been causing a lot of trouble for me at home. Definitely, my wife is unhappy with my drinking and, my behavior sometimes when I'm drinking. And it's just also, it used to be something that would help me wind down after work, but I feel like it's, just causing me more, anxiety, fatigue throughout the day. So, but I don't know, this is new for me, even thinking about this kind of thing.
You're not used to thinking about it, but you've started to notice its effect on you in a way that you're not totally comfortable with.
Yeah, I would say I would probably never have noticed it if my wife hadn't noticed it, and she, really is frustrated with it right now.
Are there any other concerns they have about drinking?
Yeah, like I said, I mean, it's always been something that has helped me like wind down after work, but now it's just like distracting at work because as the day wears on, lunchtime, after lunch, like I'm already thinking about like getting home, getting that first beer, and it's just it's becoming a kind of distraction. I feel like it's making me anxious to get out of there, and I don't know, I feel like people are starting to notice that I'm just, you know, not as productive as I have been before.
So it's kind of preoccupying and maybe even getting in the way of you being productive to the extent that some other folks are taking notice.
Yeah.
So that's a concern. The other thing I was curious about, if I can ask, is what you know about the relationship between the drinking and some of the health problems we just were talking about. Your high blood pressure and your insomnia. If you know anything about the link between those.
That's not something I've heard of. That can be related to alcohol?
Yes, absolutely.
Huh.
And maybe I can tell you a little bit more about that.
Yeah, please do.
Okay. So it is in fact, it's likely that the alcohol is playing a big role in your high blood pressure, in making it hard to keep that under control. We know that's one of the things that alcohol can do, especially given the level that you're telling me that you're drinking. It's also probably playing a primary role in your insomnia, even though it's a little bit hard to kind of wrap our minds around because alcohol tends to put us to sleep, and I'm guessing that's probably the case for you. What it also does is it disrupts our sleep, and it can make it such that we wake up in the middle of the night and have a hard time falling back to sleep, and it prevents us from getting that good, deep, restful sleep that we really need to feel okay and ready the next day. What are your thoughts about that?
And I guess that kind of makes sense. I do fall asleep with a bourbon in my hand most nights, but usually early morning, 2:30, 3 o'clock in the morning, I'm waking up and just sweaty, and it's hard to resist. I mean, at that point, you can't drink because I go to work pretty early too, so I don't want to be on the road. But it's really tempting sometimes to just wake up and keep drinking. So yeah, I believe it. Now that you've made that point, I can see how those things could be connected.
Mm-hmm. So I'm wondering, given all that we've talked about, some of the concerns with your wife, really, and with your in-laws, and just how you want to be and relate to them, some of those concerns at work and sort of the preoccupation with your drinking, and now we talked a little bit about some of the health issues that you experience that are probably linked to the drinking. I'm wondering if I might provide you with a little bit more feedback and maybe some ideas about what to do about your drinking.
Yeah, I wish you would. I mean, that's a long list of problems, right?
Yeah, it's kind of overwhelming. Well, so the thing I'll just briefly mention is that based on what we've talked about, you meet the criteria for an alcohol use disorder. And what I'd really like to think about.
What does that mean?
So that means that there are problems associated with your drinking, really. The first thing, if it's all right, if I tell you about the standard recommendation for people drinking at your level, the first thing to try would actually be to stop drinking.
Now we've seen how the provider engages with the patient in the first two of the 5 A's, assessing the patient's current drinking patterns and advising the patient of the potential consequences of these patterns. For a patient with an alcohol use disorder, the provider will recommend a goal of abstaining from alcohol. Next, we'll see how the provider assists the patient in exploring whether abstinence is a goal that the patient is willing to set and offers resources to help them attain their goal.
Like I said, I mean, this has been a part of my life since I was a kid, right? Like, it's just hard to imagine life without it. But at the same time, life's getting a lot harder with it.
So it's hard to see, because it's been such a part of your life, what a alcohol-free life would look like, but you're starting to see its effects and would maybe consider a different type of life.
Yeah, I'm definitely seeing the effects. I'm interested in what a different life, how that could even be possible for me.
Sure. Well, let me ask you before we get there, based on what we've talked about, how important it is for you to change your drinking. If we were using a sort of scale from 0, meaning not at all, not important at all, to 10 of the utmost importance, kind of tell me where you are on that scale in terms of how important it might be at this point to change your drinking.
Probably a 6, 7. I don't know. This conversation's pushed me pretty high, maybe even an 8.
Well, let me ask you a sort of slightly different question. Using that same ruler, that same scale, how confident are you that you might be able to reach that kind of goal of quitting drinking, of not drinking at all? Again, 0 being no confidence, not going to happen. 10 being I'm highly confident I'm going to make that happen. Tell me where you're at on that scale.
I mean, I don't know. Like I said, I haven't even thought about this before. It's not something I've ever tried. It's a big part of my life. I would say like maybe a 3, the confident that I could do it right now. But I mean, I don't know what's out there, like what resources or, I don't know how to do this. Maybe if I had information like that, it could be higher, but yeah, I would say 3.
So right now you're not feeling really confident, some confidence, but not a whole lot. And again,
Yeah.
it's a new idea to start playing around with. At the same time, it sounds like if you had a little bit more resources or maybe some help, that would improve your confidence.
Yeah, I'd be interested in knowing what's out there to help people with this problem.
Okay. Well, I can tell you about that. In fact, there are number one, some medications that could really help people and are shown to help people change their alcohol use. But then there's a lot of other supports and places that can help build skills to change your alcohol use that have been shown to be really successful. And that's something that we could actually set you up with here through our office. Can we maybe talk a little bit more about those and how you can access those?
Yeah, please.
The importance and confidence rulers used in the demonstration are shown here as they appear in our provider pamphlet. These can help guide conversations about personal change when used with related MI principles and practices. Lists of resources organized by AHEC region and county, as well as type of resource, are helpful during shared decision-making about more intensive treatment options. These lists also provide a useful clinic resource for all patients with a known AUD, not just those newly identified by the screening process. These referral resources can be accessed on the project website at stunalcoholusenow.org. Clicking on a region in the interactive map will download a PDF of the appropriate list, which can then be saved or printed. Before the appointment ends, the provider engages in shared decision-making with the patient, seeking agreement about options for harm reduction or treatment and referral. The provider then seeks to arrange a follow-up appointment in 1 month, at which they will ask whether the patient was able to make the changes they discussed. If the patient met their goals, the provider reinforces and supports the changes and makes a note to continue counseling at a future visit. If the patient has been unable to meet their goals at follow-up, the provider can acknowledge that change is difficult, support positive change and address barriers, review goals, plans, and strategies, and discuss additional ways to get help. Assessment for other potentially related and treatable health conditions, such as depression or anxiety, is also important. Documentation in the electronic health record can maximize the positive impact of screening and intervention for both patient and practice. Approved billing codes allow for reimbursement for screening and brief counseling. For example, Medicare reimbursement G codes include those listed here. Let's review the key points covered in this video. First, after a positive result on a brief initial screener, the patient completes the 10-question audit, which helps the provider distinguish patients with an alcohol use disorder from those with risky drinking without an AUD. Second, if providers identify an AUD, they conduct brief motivational interviewing using the 5 A's approach to determine whether the patient is willing to set a goal of abstinence or not. Third, for patients with AUD, the provider engages in shared decision-making regarding options for more intensive treatment, referring to available resources.